Hi everyone, welcome back to our channel. Today we will discuss about the most important MCQ for the Norcet and other nursing exam. Let's start. First question. A patient with diabetic ketoacidosis has the blood glucose of 480 mg per del and serum potassium of 2.9 MeQ per liter. Which action should the nurse take first? Here they told the potassium level. The potassium normal level is 2.5 to 3.5. And the normal fasting blood glucose level is 70 to 110 mg per del. So here they already told that diabetic ketoacidosis patients suffer from diabetic ketoacidosis. So option is option A, start the insulin drip at 0.1 unit per kg per hour. Option B, administer IV potassium replacement. Option C, give sodium bicarbonate IV push. Option D, infuse normal saline at 1 liter per hour. Here we have to give the administer IV potassium replacement. Option B is the correct answer. Due to normal level of the potassium is 3.5 to 5.2. Here the normal level, below the normal level is there. In diabetic ketoacidosis, drive potassium into the cells and worsening the hypokalemia. If the serum potassium level is less than 3.3 milliQ per liter, insulin must be withheld, and until potassium is corrected, insulin must be withheld until the potassium should be corrected. So the answer will be option B. Next, which finding a postpartum patient suggests uterine atony as the cause of hemorrhage? Option A, firm contracted uterus with bright red bleeding. Option B, boggy uterus that becomes firm and massage. Option C, constant trickle of blood with a firm uterus. Option D, severe abdominal pain and a rigid abdomen. The answer is option B, boggy uterus that becomes firm and the massage, because uterine atony presents a soft and boggy uterus that responds the temporarily to massage. Option A, there is suggested trauma or the written products. Option C is not correct because suggest lower genital tract laceration, and option D is suggest that the uterine rupture on the abortion. So the answer will be option B. Option B is the correct answer. Next, a client on mechanical ventilation has a sudden drop in SpO2 to 85% and absent breath sounds on the right side. What is the most likely cause? Option A, mucus plug. Option B, right mainstem intubation. Option C, tension pneumothorax. Option D, pulmonary embolism. Here they told the absent breath sounds unilaterally, absent breath sound plus sudden desaturation plus mechanical ventilator plus mechanical ventilators is all are the tension pneumothorax are until the proven otherwise. Right mainstream's intubation would cause the absent left breath sounds, not the right. Mucus plug usually causes the gradually changes. So the answer will be option C, tension pneumothorax. Next, a nurse is caring for a patient receiving warfarin. Which laboratory value indicate therapeutic anticoagulation? Option A, INR of 1.0, option B, INR of 2.5, option C, APTT of 60 seconds, option D, platelet count of 1.5 lakh MMQ. The answer will be option B, 2.5. For the most indication, normal therapeutic range is 2 to 3. APTT monitors heparin. APTT monitors the heparin, not the warfarin. Platelet count is unrelated. So option D will be not correct. APTT we will see for the heparin, and INR 1 is very less. In the normal range it indicate 2 to 3. So the answer will be option B. Option B is the correct answer. Next, a newborn is receiving phototherapy for the physiological jaundice. Which nursing intervention is the most important? Option A, cover the eyes with the opaque patches. Option B, apply the lotion to prevent the dry skin. Option C, feed the infant every 6 hours. Option D, keep the infant in a prone position. The answer will be option A. During the phototherapy, always we have to check and cover the child eyes and genital area to protect the injury or any problems. So the answer will be option A. Phototherapy blue wave can damage the retina also, and always avoid the lotions, because lotion can heat up the burn skin, and frequent feeding should be there every 2 hours. Every 2 hours. Next, a patient with chest tube for pneumothorax has continuous bubbling in the water seal chamber. What should be the nurse do first? Option A, clamp the chest tube near the insertion site. Option B, milk the chest tube to dislodge clots. Option C, assess for the air leak in the system. Option D, replace the drainage system immediately. The answer will be option C, assess for an air leak in the system, because continuous bubbling in water seal chambers indicates an air leaking. Example, loose connection can happen, cracked tubing, and or the patient pleural space leakage also can happen. The first step is located the leak by the clamping sequentially. Never clamp the chest tube for pneumothorax without provide order. It can cause the tension. Pneumothorax. So never do it. So the answer will be option C. Next, which ECG findings is the most suggestive for the hyperkalemia? Option A, prolonged QT intervals. Option B, widened QRS complex and tall peak T wave. Option C, ST segment elevation. Option C, ST segment elevation. Option D, presence of U wave. The answer will be option B. Hyperkalemia produce the peaked T wave, peaked T wave, widen QRS and flat P waves, and eventually sine wave patterns. Prolonged QT seen in the hypocalcemia or the hypokalemia, or it can seen in the hypokalemia, and U wave seen in the also seen in the hypokalemia. So the answer will be option B, widened QRS complex and tall peak T wave. Next, a patient with cirrhosis is admitted with hepatic encephalopathy. What is the condition? Hepatic encephalopathy. Which medication order should the nurse questions? Option A, lactulose 30 ml orally every 6 hours. Option B, neomycin 500 mg orally every 6 hours. Option C, diazepam 5 mg IV for the agitation. Option D, low protein diet. The answer will be option C. They asked which medication doctors which medication nurse will questions. Diazepam, because diazepam, lorazepam, these are the benzodiazepines. It metabolized by the liver and can precipitate or the worsen hepatic encephalopathy. They are avoided in liver cirrhosis with encephalopathy because lactulose and neomycin reduce the ammonia. It's reduce the ammonia, and low protein diet is outdated but still sometimes used in the acute episodes. So the answer will be option C. Option C will be the correct answer. Next, a 6-year-old child is brought to the emergency with stridor, drooling and steening upright in a tripod position. The nurse suspects epiglottitis. What should the nurse do first? Option A, attempt to visualize the throat with a tongue depressor. Option B, start IV antibiotics immediately. Option C, prepare for emergency intubation or the tracheostomy. Option D, give nebulized epinephrine treatment. The answer will be option C, prepare for the emergency intubation or the tracheostomy. Classical signs of epiglottitis are stridor, drooling and tripod position. Manipulating the throat can cause the complete air obstruction, so never do that. Nebulized epinephrine is a group not in epiglottitis, so don't give the nebulization also. The priority is IV antibiotics is not the classical fast nursing responsibility. We have to first do the emergency intubation or the tracheostomy, because the priority is to secure the airway. Always we have to secure first the airway. In control setting or ICU we have done. So the answer will be option C. Next, a patient receiving a blood transfusion develops fever, chills and low back pain. After 30 minutes, what is the nurse's priority action? Option A, slow the transfusion rate. Option B, stop the transfusion and keep the IV line open with the saline. Option C, give oral acetaminophen. Option D, obtain a nurse sample for hemoglobin. The answer is option B. Stop the transfusion and keep the IV line open with the saline, because these symptoms suggest the acute hemolytic reaction, acute AHR, acute hemolytic reaction, ABO incompatibility. The first step is stop the transfusion. First, stop the transfusion. They immediately disconnect the blood tubing. And run the normal saline NS, normal saline through the new IV line. Not use the same IV line. Use the new IV line for normal saline. Then notify provider, send the blood bag and sample to lab and monitor the urine output at last. So the answer will be option B. Thank you everyone. Please like, share and subscribe our channel.